Imagine a situation where a person is facing the very end of their life, experiencing profound suffering that no conventional treatment seems to touch. How do healthcare professionals ensure comfort and peace while upholding the highest ethical standards? The ethical use of palliative sedation refers to administering medications to intentionally lower a patient's consciousness to relieving intractable and unbearable suffering in the last days or hours of life, when all other palliative measures have failed. It is considered ethically sound when its primary intent is to alleviate suffering, not to intentionally hasten death, and when performed with careful consideration and consent. The ethical foundation for palliative sedation rests heavily on the principles of beneficence, which is acting in the patient's best interest, and non-maleficence, which is doing no harm. Crucially, it must be a proportionate response to the suffering, meaning the level of sedation used should be the minimum necessary to achieve comfort. This practice falls under the ethical concept known as the doctrine of double effect, where a foreseen but unintended negative outcome, like a shortened lifespan, is ethically acceptable if the primary intention is a good one, namely alleviating suffering. This clear distinction of intent is what separates palliative sedation from euthanasia or physician-assisted suicide. For this to be ethically applied, a thorough assessment of the patient's condition and prognosis is essential, confirming that the suffering is truly refractory to other treatments. Open and clear communication with the patient, or their legally authorized decision-maker, is paramount to ensure informed consent. Discussions should cover the goals of care, the expected effects of sedation, and potential alternatives. Family members should also be supported through this difficult decision-making process, ensuring they understand the compassionate intent behind this intervention. Clinical guidelines from professional organizations, such as the American Academy of Hospice and Palliative Medicine, emphasize that palliative sedation should always be initiated and monitored by a multidisciplinary team. This team often includes physicians, nurses, social workers, and chaplains, who collectively ensure that all aspects of the patient's physical, emotional, and spiritual needs are addressed. Sometimes, this is referred to as continuous deep sedation, highlighting the consistent nature of this advanced comfort care measure. Ultimately, the ethical use of palliative sedation provides a profound expression of compassion, allowing individuals to experience peace and dignity during their final moments. It represents a carefully balanced approach that prioritizes the patient's comfort and autonomy, assuring them that every effort will be made to alleviate their pain and distress when all other options have been exhausted, affirming their value and care until the very end.